Good evening, Dr. Kluter. Thank you very much for joining us. I want to start with the 49 deaths in the Western Cape in one day from COVID-19. That is quite a shocking number. Is that just one bad day, or do you think this is the beginning of an increase in deaths? Must we get used to this sort of death toll?
Thank you very much, Sally. I just want to clarify the 49 deaths. It was over 2 days,
okay.
And it was just the data being released to the National Department over 2 days. But we are in the phase where we are expecting upward of 30 deaths a day, and that is where we are in the acceleration of what's going to go ahead from here.
All right. Can you tell me whether the second patient to die under the age of 9 is in the Western Cape, and if so, can you tell us any more about that child?
Yes, there is a case under the age of 9, and that was a 2-year-old, and then it was a case which we obviously had comorbidities and all of those. Yeah.
Okay, thank you for that information. When do you think the Western Cape, or specifically I think it really is still mostly focused in the Cape Town area, going to hit the peak of the virus? It seems that it's going to come earlier to your part of the world than us here in Johannesburg.
Yes. At the moment, Sally, we are very much working with the Actuarial Society of South Africa. You would have noticed that they released some modelling, actuarial modelling. We're also working with MASHA. There's a national modelling group, and they released their models last week, 2 weeks ago. We are very much working with them, validating our parameters with them. We are looking at the moment towards peaking in June, towards July. That is definitely earlier than other provinces in the country, but we are currently working towards June, July.
Okay. I wonder if you can update us on these hospitals. When we last spoke, you told me that there were 120 positive staff at Tygerberg Hospital, that Mitchell's Plain Hospital had closed, and that Groote Schuur, the patients, COVID-19 patients, were indeed doubling every 5 days. We also hear that Mediclinic Cape Town has had to close to new admissions due to 25 infections of COVID-19, 14 of which are staff. Could you just update us quickly on the hospital situation, including those key points?
Yeah. As you're rightfully saying, that there's two things that we consider in the hospitals. The first one is the actual number of cases admitted to the hospital. So as I explained, it was cases that is under investigation. We call it persons under investigation. Those have been increasing. And then out of the persons under investigation, it's then people that's admitted into COVID wards, and then people that is admitted for high care and for ICU. Since I spoke to you on Friday, those numbers have increased. Tygerberg and Groote Schuur are under significant pressure. Places like Mitchell's Plain Hospital is also under pressure, and Khayelitsha Hospital, as well as the other acute hospitals in the metro. As you rightfully say, the private hospitals is also under significant pressure, and all of these numbers are starting to increase. The second thing that we're concerned about, which is probably the bigger concern for us, is that the rate of infection amongst healthcare workers are increasing in many of these hospitals as well. And that's why the figure of Tygerberg that we spoke about, being more than 120 people being infected in Tygerberg Hospital, the rate is also increasing in Groote Schuur and other hospitals. So we're taking staff safety as a key element in this, and that is to make sure that we have clean surfaces. If somebody is positive, we make sure that we screen everybody. We possibly temporarily close down a section of the facility, and we make sure that everybody is looked after in terms of infections. So the big concern for us is not just that the cases are increasing, but also our healthcare workers are more exposed, both in the hospital, but also exposed in the community setting. Therefore, more of our healthcare workers are also in quarantine and isolation. And therefore, our staffing then becomes a big challenge in terms of managing the increased cases that's coming into the services. But I just also say to you, in addition to that, you might have picked up in the news today that the additional facilities that we are planning to open are progressing very well. And at the convention center, we're planning 850 beds. There's big progress being made. and are looking at the 8th of June potentially taking our first patients into that 850 bed already.
Well, that is certainly very good news. Quick question, how many COVID-19 patients or suspected patients do you have at the moment? You had 500 plus on Friday. Has that number gone up?
Yes, I can confirm that more than 600 people are admitted into hospitals as we speak. So as I spoke to you on Friday, we were expecting that number to grow. It's more than 600 at the moment. When I spoke to you about the ICU admissions, that has gone up to more than 100 now across private and public. So those numbers are increasing as we're going. And it keeps up with the number of cases that's increasing, but also keeps up, as you rightfully say, that the number of deaths are also increasing.
I have to ask whether you're running out of tests. It's a major concern. Is it a concern for you as well?
Tests has been a huge concern. It's a countrywide concern. It's become a global concern. The big thing is that we have 3 NHLS, National Health Laboratory Service laboratories, public sector laboratories in the Western Cape. The backlog at those facilities have grown over the last 2 weeks because of the increased number of tests to quite staggering numbers, over 10,000 and 15,000 at one instance as well. I had a conversation with the CEO of the NHLS last night. They are redirecting some tests to the Western Cape to try and help us with the backlog for this coming week. Our priority in testing, you can imagine, is that the people that's in the hospital waiting to be admitted into the ward, it's quite important that we get a quick turnaround time for that result to help us with the intervention in the hospital as the hospital starts filling up. And secondly, very importantly for us, is when any health workers are exposed, that we can get the result back for the health worker as soon as possible. That helps us to actually manage in terms of what we do.
Thank you very much for your time this evening. We do appreciate it. That's the Western Cape's Head of Health, Dr. Keith Klutter. They're talking about 600 people admitted to hospital currently in that province with COVID-19 or suspected thereof. Over 100 people are in ICU.